watching Eye on Africa. I'm James Creedon. A time for a catch-up of the news stories from across the continent this evening. Life goes on as normal for most Africans, but states are ratcheting up their preparations for a possible coronavirus epidemic. We'll get the latest from across the continent. And we'll speak to our correspondent in Liberia about the situation there. Has facing the Ebola crisis helped Liberia in its readiness? More on that a little bit later in the show. Thanks for watching. Now, we'll start with governments scrambling to increase their capacity to deal with an expected surge in cases of the coronavirus. And, of course, prevention is better than cure, and several countries are putting the focus on ramping up detection and prevention measures as a priority. Laurent Berstecker has more.
With far fewer cases than China and Europe, Africa has been battling to keep the coronavirus at bay. But as the number of infections increases daily across the continent, authorities have begun preparing for a worst-case scenario. Many countries warn they don't have the tools and resources to deal with a potential outbreak.
Our health system is not as strong as we'd like it to be. It is because we're a bit worried about our capacity to deal with a large outbreak that we are focused so intensively on prevention and early detection.
Nigeria is one of the countries that's been drawing on its experience fighting Ebola to contain the epidemic. Some of the measures put in place across the continent include setting up systematic screenings at airports and borders, closing schools, universities, and places of worship, as well as promoting good hygiene and asking potentially infected individuals to stay at home. But in many areas, residents sometimes lack the resources to comply with official instructions.
People ask us, how do we wash our hands when there are water cuts? We tell them to have water bottles available, to buy mineral water. But you know, sometimes their financial situation just doesn't allow it.
With many hospitals already overburdened with patients suffering from malaria, measles, and other diseases, African countries hope their containment and prevention measures can help avoid a potentially disastrous coronavirus outbreak, especially in shanty towns and informal settlements where populations are most vulnerable.
Now, for more on how different countries are preparing, we can cross to Monrovia, the capital of Liberia, to speak to journalist Darlington Porkba. Darlington, you're based in the Liberian capital with their sister radio network, Radio France Internationale. I understand a second case has been confirmed in the country this today. What more can you tell us about the situation there?
Thank you so much. You are quite correct. We just confirmed the second case here of the coronavirus disease. And it happens to be the domestic worker of the index case that was actually reported here by the government of Liberia. And the index case is a 46-year-old Liberian who just returned from Europe. And he was heading the Liberia's Environmental Protection Agency before contracting the virus. So he contracted the virus, and the government said he breached necessary health protocols. So President George Weah initially yesterday announced his dismissal. So the president had dismissed him already. So yes, the index case is a Liberian 46-year-old who returned from Europe recently. We just confirmed the second case, who happens to be a domestic worker to that index case.
Now, I suppose many will remember the terrible Ebola crisis that Liberia in particular was affected by. So I think one clear question is, have lessons been learned by the healthcare system, by the authorities, in terms of how to deal with a lot of cases of a virus that can be dangerous? Were lessons learned from the Ebola crisis in the healthcare system?
Indeed, lesson was learned from the Ebola crisis, and based upon that, health officials here, especially so medical officials, have rolled up their sleeves trying to put in the necessary mechanism to ensure that Liberia cannot retrogress or cannot go back to the Ebola area. So right now, as we speak, there is an intense engagement with the communities. The health authorities are actually engaging with the communities members to ensure that all of those who came along with the index case on SM Brussels actually located and quarantined and test and ensure that they are either negative or positive. And those who are considered as high risk are being quarantined, as the government said today, and they are actually doing their viral tests to ensure that they are actually safe. So yes, indeed, lesson has been learned from the Ebola area, and it is actually community-based, where you have the government reaching out to the community, and then you have various communities coming together, grouping themselves to ensure that they rally around to have the necessary information sharing with necessary household in the community. We know there's some challenges, especially so getting the necessary logistic, but on the overall, yes, indeed, the community is actually involved with this situation here, and health authorities too are on top of their gains as we speak. Basically, we have noticed that they are being engaged in various communities to ensure that if there's any sick people or sick person there who actually came with the flight, are reported to health officials, and the necessary precaution taking quarantine and make sure that the situation does not exacerbate as compared to the situation with Ebola.
Okay, Darlington Porkpie, thank you for that update from Liberia. Now, next to the situation in Ivory Coast. Ivory Coast is amongst the West African countries that has taken firm measures to prevent the spread of the virus. The government has set aside 4 billion CFA francs, around 6 million euros in preparation. Yet just 6 cases have been detected nationwide so far. From Abidjan, Sam Bradpeace has more.
The government here in Côte d'Ivoire certainly seems to be taking coronavirus seriously. While the number of confirmed cases remains relatively small, it has announced a number of measures to prevent the kind of contagion that we've seen in parts of Asia and parts of Europe too. Now, among those measures include shutting down international arrivals routes from countries with 100 or more confirmed cases, also the shutting down of schools, and in the coming days we're going to see cinemas, nightclubs and any kind of gathering of more than 50 people also shut down. We spoke to Ivorians here on the streets of Abidjan to gauge how they feel about the government measures.
Les mesures qu'il a prises, nous, on est dessus même, on est content même. Nos enfants vont rester tranquilles à la maison, on s'occupe de nos enfants nous-mêmes. Nous-mêmes aussi, on s'occupe encore de nos parents. On va enseigner aussi comment on lavait les mains à nos parents qui sont au village. C'est comme cela.
Mais ça a été peut-être un peu tard. Ouais, le virus est déjà ici. Mais de nous avant, c'est bien pris. Il faut, on va les respecter convenablement. Ouais.
Je pense que ce sont des mesures pour, on appelle ça, diminuer un peu la progression de la maladie. Donc, ce sont des bonnes mesures.
Côte d'Ivoire is not the only West African countries to take preventative measures against coronavirus. We've also seen Ghana and Togo among those to shut down air routes from Europe. The obvious question now is, do authorities have the capacity on the ground to impose restrictions? And will these restrictions be enough? Only the coming weeks and months will tell.
Sam Bradpeace in Abidjan. Now, on Monday, Zimbabwe's defence minister said the coronavirus is, quote, an act of God against the West. That was offset by President Emerson Mnangagwa issuing a statement saying coronavirus has a scientific explanation and knows no boundaries. The president went on today to announce a national disaster. That's a preparatory move to maximise readiness, as for now the country has not recorded a single case. Let's take a listen to Zimbabwean President Mnangagwa.
While we have no recorded cases as yet, the economic impact of the pandemic is already being felt. Government has postponed the Zimbabwe International Trade Fair, ZITF. All national independence celebrations previously planned and the pending international sporting fixtures until the threat of coronavirus recedes.
Now to some other news stories from across the continent this Tuesday. Niger says that its army has killed at least 50 Boko Haram extremists after an attack on a military post. Authorities say Boko Haram attacked soldiers in Tumour in the east of the country near the border with Nigeria, where Boko Haram is mostly based. In Sudan, the prosecutor's office has ordered the arrest of the former foreign minister. Ali Karti is being pursued for his role in the 1989 coup, which brought Omar al-Bashir to power. Bashir was ousted in April following mass protests against his 30-year rule. He has since been indicted by the International Criminal Court. Moroccan journalist and human rights activist Omar Radi has been handed a 4-month suspended sentence for criticising a judge in a tweet. Radi again took to Twitter to report the verdict handed down by a court in Casablanca. He called it an attack on his freedom of expression. All right, that's all we have time for in this edition of Eye on Africa. Thanks for watching. Do stay tuned.